The examination of the 2009 H1N1 pandemic offers a multi-phase perspective on the challenges and responses to a global health crisis. The background talks about the 2009 H1N1 flu pandemic, which started from a new type of flu virus. This virus was first found in pigs and became a big problem worldwide because it spread fast and could make people very sick or even cause death. It spread quickly across countries because of modern travel, showing how connected our world is. This situation showed that it is important for countries to work together to fight diseases. Governments, health organizations, doctors, and scientists all teamed up to stop the virus from spreading and found ways to prevent it and treat it. The pandemic brought up a lot of different problems. It was hard to get vaccines to everyone who needed them, and our plans for dealing with pandemics weren't good enough. At the start of the virus, there weren't enough vaccines to go around. This showed us how important it is to have strong ways of making and giving out vaccines. Also, we saw that our system for watching out for outbreaks and how we react to them needs to be stronger, quicker, and better. This means we need to keep working on making our plans of action for dealing with pandemics better all the time. To understand what's going on now, we looked up at how decisions are being made by an analysis called SWOT. This helps us figure out what's good and bad about the situation and what chances and risk we have. The World Health Organization played a big role in bringing countries together to fight the pandemic, which matches its goal of keeping people healthy everywhere. Good things in the response included countries working together and scientists sharing info, which helped make vaccines quickly and overall better. But not everyone could get vaccines. And it was hard for different groups to talk to people and work together smoothly. We looked deeper into why these problems happen, especially how viruses change, spread between animals and people, and how connected the world is. When we have the world all this connected and the viruses are spreading this easily, it is very easy for people to get sick quickly. Flu strains like the H1N1 show how diseases that jump from animals to people can be really dangerous. This means we always need to be watching out for new sicknesses and be ready to act fast when they show up. People have come up with a few solutions to tackle this issue. One approach involved influencing people's behavior and attitudes towards health. Using theories that explain how people perceive health risks and benefits, the goal was to encourage more individuals to get vaccinated and adopt preventive measures through targeted messaging and educational campaigns. Another solution focused on improving access to vaccines, especially in areas where it's difficult to reach healthcare services. This could involve setting up mobile vaccination clinics that travel to different communities or partnering with organizations that aren't typically involved in healthcare to help distribute vaccines. By exploring these alternative strategies, the aim was to make vaccines more accessible and increase their uptake among the population. Some other issues that we faced with this were getting people who dislike vaccines to get on board with taking them. We would show them facts and show them the statistics of people getting better, but still we had an issue with getting people on board and taking all types of vaccines. After learning more about the situation, we realized how crucial it is to upgrade our strategies for handling pandemics. This means having clearer and more effective plans in place, such as these three: enhanced pandemic preparedness, behavioral interventions, and enhanced vaccine distribution. Also, we need to make sure vaccines reach everyone who needs them quickly and fairly. Plus, it's important to spread the word about ways people can protect themselves, like washing hands and wearing masks. These suggestions aren't just guesses. They're based on what experts and public health research and practice have found to work. By acting on these recommendations, we can better be prepared to deal with the future pandemics and reduce their impact on our communities as a group. A detailed plan was created outlining specific actions, who would be responsible for carrying them out, and when they would be done. All aimed at improving the situation, the plan had three main focuses. First was to aim and enhance our ability to detect outbreaks early by improving surveillance systems. This would allow us to be able to detect when people are getting viruses quickly and be able to move them away from a general public so that they will not be able to get infected. Second, it aimed to ensure that vaccines were distributed effectively and reached everyone who needed them. This was making it so anyone had the chance to best survive if they were to get sick and not just be ready to go down whenever. Third, it aimed to encourage healthy behaviors among people to prevent the spread of diseases. These actions included making new rules like wearing masks and getting the word out to communities about how to stay safe. The ultimate goal of the plan was to make sure we were better prepared to handle any future health emergencies that might come our way. The timeline on this to strengthen our surveillance was about 6 months, and to improve vaccines was 2 to 3 years. In simple terms, it's important for us to team up and think ahead when it comes to dealing with pandemics. By studying what happened in the past and using the latest scientific discoveries, we can be prepared to stop diseases from spreading and make sure everyone stays healthy all across the globe. This means that if we were to work together and stay ahead of the game, we can keep sickness under control and protect health everywhere.